start off with telling me about the company you work for?
The lab that we is based in Richmond, Virginia. They're the largest, oldest lab in the country. Out of all the labs that exist that do DNA testing, they're the only lab that is CLIA certified in all 50 states.
And could you extend on what pharmacogenetics is, essentially?
It's evidence-based medicine. When your doctor prescribes a medication for you, he gives you a certain dosage based on a guess. What evidence-based medicine does, it allows the doctor to know exactly what medication to give you and the amount to give you based on how your body metabolizes the medicine. You metabolize it slowly, fast, very slow, or normally. So with that information, the doctor can hone in on exactly what you need, which medication you need, and you have a quicker response, a better response, and you have a better result.
And how do you think that this company, Biotech, will benefit toward the future of medical prescriptions?
Well, with the testing that they do, they allow the doctor, most specifically, to be able to prescribe better medicine, be a better provider for you. And also, if given the number of medications that exist in the marketplace, it provides them the data and information that basically lets you feel better. If you're taking Adderall as a child because you have ADHD, if they use a normal dose and you happen to be a certain metabolizer, it lets them hone in on exactly what they need to do. If this company can do that, it's going to make you feel better, it's going to give the doctors information to make them better doctors, and it's going to lower the cost of medical care across the country.
So you have these DNA testing kits, and how do they work, and what's the process behind them?
That's the easiest part. The doctor has a form that they use to order the test. They have a cotton swab that most people can open. They do this on a daily basis. 2 swabs. They swab each cheek. 1 buccal swab. They put it back in the pouch, put it in the FedEx pack. It goes directly to the lab, and it's all coded, so they know exactly within 48 hours, maybe 3 days, whose DNA this is. The report goes back to the doctor by web docs, by email. The patient comes back in, they meet with the doctor, and now they know exactly what to prescribe, how much to prescribe, so the patient feels great, and the doctor did his job.
All right. And if a patient is prescribed a medication and he's taking it to go sell, how can the doctor tell that that's really happening, and if he's not taking it, is?
Well, what the doctors will do for the patients that are on Adderall, they will do a tox screen, which will provide the doctor very simply evidence that lets them know if the patient is taking the drug prescribed, or in some cases taking drugs not prescribed. Now, in the situation where the patient is taking the drug, he's not selling the drug, if there's an issue that's brought up through the confirmation, which tells the doctor exactly what's in his system or her system, it may lead the doctor to the next step, and that is to DNA test that patient, which simply would tell the doctor which drug, if not Adderall, is the best drug, and which amount or what dosage he should be giving the patient.
Okay. So what does this interview mean to me? Adderall is metabolized through the CYP450-2D6 gene in a person's body. 7 through 14% of the population has a slow-acting form of the 2D6 enzyme. 7% have a super fast-acting form of the 2D6 enzyme, and 35% are carriers of the non-functional 2D6 allele, which have an especially high risk of having adverse drug reaction when these individuals are taking multiple drugs. Based on this information, it is imperative that an individual who has not been prescribed a medication and does not know what their metabolizing status is should avoid taking medications because they can have an adverse drug reaction to many classes of drugs that go down the CYP450 2D6 genetic pathway.